everyone. Good afternoon, and so happy to see so many of you here. I'm joined today by Allison Rizer, Executive Vice President, ATI Advisory, and we're going to talk about supplemental benefits, really just kind of spotlight of what's been happening, the current environment, context, and all of that. We've only got a little bit here today before we're joined by a special guest, so we're going to just jump right into it. So Allison, I'm going to turn to you.
Thank you, Caitlin. Thank you for the opportunity to be here today. I'm really excited to chat about supplemental benefits with you and everyone in the audience. As Caitlin mentioned, Allison Rizer with ATI Advisory, and we work across Medicare, Medicaid, really focused on policy, research, strategy, operations, and have had the good fortune of partnering with BMA now for many years, really digging into Medicare Advantage and trying to understand what the experience is for beneficiaries who choose to enroll in Medicare Advantage, how demographics have changed, how geographic coverage has changed, and how some of the innovative models in Medicare Advantage have kept up with trying to meet the needs of Medicare beneficiaries. I'm going to spend a little bit of time talking about one of our favorite acronyms in Medicare Advantage, SSBCI. Hopefully everyone knows that. If you don't, you will by the end of this session, Special Supplemental Benefits for the Chronically Ill. But first, pulling really far up, some policy context on supplemental benefits. So all Medicare Advantage plans are required to cover all Medicare benefits, Part A and Part B, that you would receive in fee-for-service. Medicare Advantage plans have the opportunity to go above and beyond that and provide extra benefits. And these typically take the form of supplemental benefits. More than 99% of Medicare Advantage plans offer some sort of supplemental benefit. And historically, these were very medical in nature, much like the Medicare program has historically been very medical in nature. And so they would take the form of dental, hearing, vision. But a few years ago, through acts of CMS and Congress, the policy environment flexed in a way that allows Medicare Advantage plans to now cover non-medical supplemental benefits. So in 2019, CMS expanded the definition of supplemental benefits in a way that allows Medicare Advantage plans to now cover things that we think of as more LTSS-like in nature, long-term services and supports types benefits. So respite care, caregiver supports, in-home supports. And then a year later, Congress took it even further. In 2020, they created this SSBCI pathway. And essentially what that did is it said, for individuals with medically complex chronic conditions, CMS defines what that means. You can provide benefits that we think of as more SDOH, social determinant type benefits, food supports, non-medical transportation, rental subsidies, and other general supports for living. This was a major turning point in Medicare policy. I would say probably the biggest policy change in the program since the creation of the Part D benefit, one of the maybe top 5 milestones in Medicare, in my opinion, in the history of Medicare, because truly for decades, Medicare was acute care, post-acute care, medical care. It was like very bound. And all of a sudden, Medicare Advantage plans had this opportunity to go outside of those bounds and really think about serving the person more holistically and covering some of these non-medical benefits. So the market kind of dipped its toe in this non-medical space the first year that both of these CMS and congressional authorities were available, 2020. We had about 14 to 15% of Medicare Advantage plans covering these benefits. Fast forward now, 2024, 40% of Medicare Advantage plans are covering at least one non-medical benefit. And special needs plans, a type of Medicare Advantage plan, 75% of them are covering a non-medical benefit. So to me, this signals the market is really starting to get accustomed to what it means to work with non-traditional providers, what it means to just provide, again, a very different type of Medicare service to Medicare beneficiaries. And it means the market itself, the consumers, the Medicare beneficiaries enrolling in these plans are getting more comfortable with demanding these benefits. They know what they are, they know that they like them, and they want them. Understandably, at the same time, policymakers are kind of looking at this with curiosity in some instances. We suddenly have this very different thing in Medicare, non-medical benefits, and in some instances with a little bit of skepticism. Are we, as a policy community, getting what we're buying with these non-medical benefits? Do people have access to them? Are they using them? What are their outcomes associated with these benefits? And so we've seen over the past maybe 12 to 18 months a number of different policies related to supplemental benefits and this non-medical SSBCI space in particular. spend a minute or two talking about a few of those, and then the rest of the time talking about something I'm really excited to release with BMA soon. So the first couple of policies, CMS is at a point where they are really looking for more transparency in a number of things in the program, supplemental benefits being one of them. So understanding encounters reporting, what are Medicare Advantage plans providing in terms of these services, who's using them, issuing mid-year notifications to beneficiaries regarding what is left in their supplemental benefits. But one policy in particular that led to the research that ATI was able to work with BMA on is that beginning in January 2025, Medicare Advantage plans, if they filed an SSBCI benefit in their bid, they have to have evidence that the SSBCI they filed has the reasonable expectation of maintaining or improving a person's health. So let's unpack that a little bit. There's 10 categories of SSBCIs. I rattled off a few, but again, food supports, non-medical transportation, pest services in the home modifications, general supports for living, which includes things like utility payments, rental subsidies, and a number of others, air conditioners. So things that if you're in Medicaid, you're thinking to yourself, well, sure, like we've seen those in Medicaid for a long time, but again, very new in the Medicare space. And so the specific requirement is if you file it, you've got to look back for 10 years and make sure that in fact the evidence supports you filing this, that there is going to be some sort of meaningful outcome for the people that you're serving. So we worked with BMA to do a really in-depth, robust set of research questions and investigation into each of these 10 categories of SSBCI, pulled together a really comprehensive database, and looked at all things that we could find for the past 10 years, systematic literature review, much of it in the US, but in some instances, other countries are a little bit ahead of us in the SDOH space, so we looked at other countries in terms of their evidence as well, and then categorized it. Is the evidence pointing to positive outcomes with these benefits, or neutral outcomes, or negative outcomes? Is it working best for people of certain age groups, certain demographic cohorts, et cetera? So really excited to provide this research to Better Medicare Alliance. I know it serves a specific policy reason at the moment, but I do think that it helps the whole research community and individuals serving this population to really start to understand how do we think through these benefits and targeting our solutions to better serve people with these complex needs. So that was a very fast walkthrough of some supplemental benefit background and some of the research that we did with BMA. Caitlin, I'm so excited to hand it over to you actually to preview the tool that is going to communicate this really robust research moving forward.
Yes, absolutely. And thank you so much for just setting the table there on what's been happening in this space, because there is so much change going on, and the ability to offer some of these benefits, but just also making sure that they're really impactful for beneficiaries as well. And so we did undertake this really great research project with you all. And so to Allison's point, we will be previewing it. We are looking forward to releasing it to the public here over the next few weeks. But again, it's for a broad range of audiences, right? It's for health plans who will be developing their designs, their products around this SSBCI, but it's for the research community and others as well to really identify what some of those gaps are and how we can continue thinking about this and develop the Medicare program in a way that really meets beneficiary needs. And so, thank you. This is what the tool homepage looks like. We're really excited about this one. Users will really begin on this landing page here, where it explains a little bit about the background. How did we come to this place? Why are we putting this together, especially on the regulatory front? But then it also breaks out the different categories of SSBCI, and so you can click on it and really search around the different literature that we've compiled here. We also have, of course, the navigation page, which will offer some additional information around the methodology and the definitions that we used in this tool. Again, that was really key here, making sure that we were being consistent when we were doing the the literature review. And so there's some supplemental information there to help navigate or help orient the users as they work through the tool. And then this is just another quick snapshot of the issue area database that we've built out. And then we have a really robust search function as well. And so you can look within a discrete category as exemplified here. It's the food and produce SSBCI. And so you can look at all the different peer-reviewed journal articles and the gray literature around it, just really comprehensive. And then you can also move into a search tool. And so you can tick off whether you want to look for research that focuses on a particular population, whether they're over the age of 65 or have a specific chronic condition. And so it's a really exciting tool here that we're launching, as I mentioned, here in the coming weeks. And so just wanted to give you a little sneak peek of that here today, and how BMA is continuing to think about supplemental benefits, and specifically SSBCI here for all of our partners. And so again, we're really excited, and thank you so much for joining us here today, Allison. Appreciate your insights as always.
Absolutely. And I think, real quick spoiler alert, unsurprisingly, health-related social needs are met when you provide these sorts of benefits. So you'll see that called out in the data. The absence of these services can be bad, and the presence of them can be very meaningful. So lots of detail packed in there, and hopefully this continues to help people refine their solutions.
Yeah, absolutely.
Thank you.
Well, thank you, everyone.